Good evening. Welcome to Instagram Live on this amazing Friday afternoon as we have a special guest, Cara, today, who I'm so honored to conversation about Previvors and what Cara is doing in the community and why we've come together and how to make this a better place and space for all of us as we've been doing a lot of educational talks, but today I wanted to come on with a fellow Previvor, which is very different for Braca Strong. So I'm super excited to have her. Hey, Cara, welcome.
Hi, how are you?
I'm good. How are you?
I'm good, thank you.
You have a beautiful glow. I love it. Like you're glowing on this end.
Thank you. It's tinted moisturizer.
Ooh, I love it. I definitely have to look into it. Like I like the shine that it gives your face. Like,
Thank
because
you.
on the camera, sometimes we look so blah, right? I'm
Right,
like,
you
I just
ring light.
Right. And I just started wearing red lipstick. Like one day I saw somebody with it on and I'm like, I need something like that. And now I'm like, I have to get other colors because red's getting boring.
It
I'm
looks good.
38, I never wore lipstick.
Yeah, because you wore it last week too, and it looked great on you. I noticed it.
Thank you. Something different, right? Trying to brighten up the calls as everybody gets to see our face all the time. Well, thank you so much for coming on today. We're super honored to have you here and, excited just for our conversation and letting our community know what we're doing and the differences that we want to make in our community as I'm in a different state than you, but we still connected. So for those of you that don't know me, I'm Tracy, the founder of Braca Strong. It's great to have everybody live here today, just carrying on a basic conversation with another provider and exploring and sharing pieces of information that women always look for, which I feel is so important to have, where you can go have a basic conversation with another provider or survivor. But, sometimes providers just want to connect with other providers. And I think that that's an amazing opportunity for other women to know some of the bumps and some of the easy parts of our journeys, right? As everybody has a different journey, different diagnoses, and coming together as a community to, unite as one is really imperative. So if you want to maybe just do a short introduction, who you are, about your Instagram page, and then we can go ahead and get started.
Okay, so my name is Cara Capello. I'm the founder of Breast Previvors ROC, and my organization supports and advocates women who are faced with a high breast cancer diagnosis. You can find me on Instagram at Breast Previvors ROC.
Perfect. Well, thank you again. And, Karen and I connected about, let's see, how long are you into your journey now?
2 years, a little over 2 years.
So I think right when you started your journey, we connected, right? Am I right? Is it that
Yeah.
long?
Yes.
And, Cara's a little different. Obviously, again, for those of you that don't know, I'm BRCA2 positive, but as we know, there's other hereditary genes out there, and Cara's actually ATM, right?
I'm actually
And
checked too.
check two. So she's check two, and different variations, obviously, of different genes work different ways, but they follow the same protocols of taking preventative action. So maybe kind of give a little bit of background on your story and what made you come on and share, where your journey started. Let's start there. Like, how did you find out? How old were you?
Okay, so we'll go back a little bit further. So I've had a couple brush-ins with cancer. When I was 32 years old, I got diagnosed with stage 2 melanoma. And thankfully, that was just a surgical removal. They removed all the margins. It was clear, and I was good to go. And just had basic skin checks after that every 6 months. And you get dysplastic atypical cells, and I've had about 45 removals since then for the last 10 years. I started developing GI problems for many years, and I met with a GI doctor and said, you know what, let's kind of get to the bottom of this. Let's get a colonoscopy and let's see, if we can find anything. And I'm glad that I did because they found precancerous cells of polyps, and so they were removed. So then I went on a high-risk protocol for that. And then when I was 37, I developed a lump in my left breast, and I was concerned about it. So obviously, you go to the doctor, and then I got sent to get imaging done. So they did a biopsy and they did ultrasound, and it came back benign, but I found out that I had really dense breast tissue. So you have like a dense scale from 1 to 4, and 4 being the most. I had 4, and based on me having melanoma and having precancerous polyps, I kind of went into a high-risk screening for surveillance, just to do, even though I was under 40, they still wanted me to do yearly mammograms just to keep on top of things. And so then I went back a year later. I did another mammogram, and coincidentally, they started a genetics program where I was, and they said, based on your family history, you would qualify from genetic testing. And so I met with a genetic counselor. I talked about my family history. I did a simple blood draw. 4 weeks later, she called me back with my test results that I was CHEK2 positive, and I didn't know what CHEK2 was. I never heard of it. I'd only heard of BRCA1 and BRCA2, and I wasn't really surprised about finding out I was high risk for breast cancer. I brushed with it so many times, and it runs in my dad's side of the family. So, she basically presented me with, you have two choices here. You can either, for you, my lifetime risk is 46%, and anything over 20% is considered high risk for genetics. She said, you have two choices. You can either do high-risk screenings every year for the rest of your life, which is 2 mammograms, 2 ultrasounds, 2 MRIs every year for the rest of your life, and hoping that you catch it early, or you can have a prophylactic mastectomy to reduce your risk. And because I've already brushed with cancer and know that I was high risk, I knew that I wanted to be prophylactic and jump on it as soon as I could, because if I knew that I was able to prevent breast cancer from starting, I would definitely do it, because breast cancer is very scary. And, thankfully with genetic testing, you have the capability and the knowledge of being able to take your life in your own hands and be your own superhero and create a new destiny and a new healthy lifestyle for yourself. So once I got diagnosed, I was very, I wouldn't say disheartened. I would say that I was very lost in the journey. I was lost because there was no advocacy or support for previvors like myself. There are many people who have breast cancer who have support services for them. I am a researcher. I love to educate myself. It's just who I've been my whole life. And going into my community, talking with other cancer agencies and organizations who support breast cancer patients, do you offer anything for previvors? No, I'm sorry, we don't. So it's like, I wanted the connection. I wanted support. I wanted somebody to help me. I didn't know anyone who has breast cancer. I didn't know anybody to help me through my journey. So I did my own research. I went on the internet. I went on to social media. I started looking up like Previvors and prophylactic mastectomy, and just gaining knowledge, talking with other women, because I wanted that connection, because I didn't have it in my community. And it was through that, in talking with other women, that I started consulting with my doctors and many doctors, and just really getting the knowledge that you needed, because it is a big decision. It's life altering. There's many setbacks and complications that can happen. And I really wanted an open mind going into this, knowing exactly what I was getting myself into, because I didn't really have to do it at all if I didn't want to. Some people are okay with doing high-risk screenings the rest of their life, hoping that it gets caught early, or maybe they just don't get it at all. But I just wasn't willing to take those odds. So on March 25th of 2019, I did my prophylactic mastectomy. I did bilateral, I did nipple sparing, skin sparing, I did tissue expanders under the muscle. I expanded for a couple months. My tissue expander leaked. I needed to swap out. I did another expander. I had my, oh my gosh, I can't talk today. I had my reconstruction shortly after that. Had implants put in. I had a nipple graft put in. My plastic surgeon, he was amazing, because like when you have your nipples kept on after a mastectomy, and obviously they take out all the tissue and they core out your nipple, there's a chance of necrosis, and I was pretty close to losing everything, and thankfully I didn't. But the left nipple was inverted in, and it was really bothering me. And my plastic surgeon said to me, he said, I can fix that nipple for you. And I said, well, how can you do that? He said, well, when we do your reconstruction, since you're open anyway, I'm going to take a piece of your rib cartilage and I'm going to put it inside your nipple and stitch you up. And you'll never know that you have rib cartilage in your nipple. And he was a genius because it came out perfect and great. Um,
Oh, that's interesting. I've never heard of that. That's so interesting. You definitely have to connect us to him because I think that needs to be spoken about. I've never heard of that. And we hear about women who have inverted nipples all the time.
yeah,
So I think that's
exactly.
amazing.
Yeah, and with me being so thin, and after having a mastectomy, my surgeon is very, very thorough that did my mastectomy. And obviously, when you're removing breast tissue, you're not only removing the breast, but you're moving all the way up to your collarbone, and you're moving all around the armpit. So when you're really thin and petite like me, I was left really concave. And so even with having implants put in, I still had this big dip in here, and I was just very deformed. And so my plastic surgeon said, hey, you would be a good candidate for fat grafting. Let's do some fat grafting. So I did my first round of fat grafting last June. And when you have fat grafting, it's like a 50-50. Your body absorbs about 50% of it. So you obviously need a second round. So I went and did a second round in December, and it still wasn't, it still didn't take as much as I would have hoped to, and that was okay. So we said, let's let this settle. Let's see how you do. And then if we need to, we'll do a revision. And so I did do a revision this past March. So I went up to a bigger CC of implants, and I went from a soft touch silicone to a high cohesive, and it made a huge difference, and it fixed everything, and I'm so happy.
That's amazing. Those are the stories that we need to hear because, like you said, right, some people have complications in going through, but there is success on the other side of being a provider. There might not always seem like it and feel like it, but there really is success. And, a lot of us don't want to go for revisions or get fixed. And, we make the choice, right? So we have to accept our new normal, but finding that new normal and being comfortable is imperative.
Oh,
And,
absolutely.
and
And
I
you're
think that,
reminded of it every day. Like, you're never the same. You like, people talk about, oh, well, you got a free boob job. Well, I hate that. And anybody who's had a mastectomy knows that a mastectomy is not a boob job. You are left deformed. You will never be perfect. You will have inflammation. You will have rippling. You will just never look the same. And you need to accept that. You'll never be the same, but be grateful because you're healthy and you're living, and you should just love yourself despite your flaws.
And I think, that's a really big part in our community is loving ourselves. And I know self-love is often absent, right? Like in going through a journey and going through different complications, losing implants, flaps failing. I think our community gets so overwhelmed and we forget to be grateful or be thankful because of that. Excuse me, I'm choking. Um, I want to back it up just a little bit if you don't mind. Excuse me, to talk about, the check 2 mutation. We hear about all these different mutations, but do you know from your side, does the check 2 mutation follow a certain protocol? Do you follow exactly the BRCA guidelines? Like I know PALB2 follows BRCA2. Do you know how check 2 works?
So you have the high risk category, which is BRCA1, BRCA2, and then you have PAL2. And then
Hmm.
you have a moderate risk category, which is CHEK2, and you also have the ATM gene. And
That's
with
what I
the
thought.
CHEK2 gene mutation, you're not only increased for breast cancer, but you also are at increased risk for colon cancer, thyroid cancer, and prostate cancer if you're a male. And so obviously, if you find out you're high risk, you still do your high risk screenings for breast cancer, but you start doing colonoscopies at 40 years old just as a preventative.
At
And
40? Did you say
40,
40?
40, yes. And obviously, if you're a male, that's something that you want to bring up to your doctor about getting ultrasounds done of the prostate, just to kind of keep on top of things, as well. So I think it's important to have those screenings, and obviously, this is a gene mutation and it could be passed on to your kids, and they can't get genetically tested until they're 15. Or if you have a sibling and you have the gene, you want to make sure that they got tested. And, when I found out I was checked too, I told my brother about it. He didn't want to know. I said, well, what am I going to do about that? It's kind of like one of those things. It's like genetic testing. It's like some people just don't want to know because it's kind of like you're playing with fate.
Hmm.
But I feel like knowledge is power, and why wouldn't you want to know so that you could live a longer and happier life? Because what I've learned in this journey is that time is a gift, and how you choose to spend that time is a gift. And you have to make every day count.
Exactly. When we talk about GI issues, right? Same thing. Like a lot of us always focus on a genetic mutation is, oh, let's worry about our breast or our ovaries, but really our uterus, but it's really so much more. And you brought up two really good points, and I think that we should go over them. Melanomas, skin is definitely part of a genetic mutation. I know BRCA2 and BRCA1 and PALP2. I really think that everybody once a year should have screenings by a dermatologist. And you need to remind yourself, ladies, it's just not about the breast. It's about the woman. We are a whole body. Yes, a lot of us go through mastectomies. Making decisions aren't easy, even for survivors. But let's take our breast out of it sometimes and really focus on the woman as a whole. And I am wearing my shirt today. It's not about the breast, it's about the woman, because
That's
we
right.
often forget, right? Like if you didn't have skin issues, melanomas before, like would you be following up with your yearly dermatologist? Like,
No.
and when we talk about these genetic mutations, GI, same thing. There's no screening for pancreatic. There's no screening for ovarian cancers. These are things that we need to bring more attention to in our community because, yes, a mastectomy isn't a free boob job. There's mastectomy options out there, reconstruction options out there. But what are we doing to make a difference? And that's kind of why I wanted to come on with Cara was for her to share her story, which thank you so much for opening up to the community about, sharing you have children, they're both at 50%, the reconstruction that you've gone through. Because a lot of us don't want to share a reconstruction, like what's happened. Like, yes, I went, I had expanders, then I had reconstruction. That's it. But
Yeah.
now, and I could tell you over 6 years since I had my mastectomy to 2004 when I was found out I was a carrier, it has changed drastically. There's over 15 reconstruction options now. Did you know that?
Yeah. It's pretty wild, isn't it?
It's really mind-boggling to me. And, I really want everybody to know, and every woman out there, every caregiver, every husband, anybody that's tuned in listening, ladies, knowledge is power. Know your breast reconstruction options. Know your genetics, right? Talk to your family. Your family doesn't talk about it. Talk to your mom's side or your dad's side. Different ethnicities, different religions don't want to talk about it. But if we can find out that we have more genetically predisposed women and men in our community, maybe cancer wouldn't get to stage 4. And there's options that we can do to prevent it. No, after having a mastectomy, I think it's like a 5% chance that you can still get breast cancer. Do you want 80% or 5%? Me, I want 5%. Genetic testing isn't for everybody, or for some people, it is for them, like you said, and instead they want to be screened. I know me personally from the time I was 21 till the time I was 32, I had mammograms, ultrasound, and MRIs every 3 to 6 months. The worst anxiety of my life. I personally decided, have kids, go for it. You did the same thing, and it's everybody's different, but just know your options, ladies. You can go on BRCAstrong.org. All of your breast reconstruction options are there. Every single one of them, as we have partnered with PRMA Plastic Surgery in Texas, they have provided us every single reconstruction option. Ladies, go to BRCAstrong.org, check those out. Genetic testing, same thing. Know your options, know what's out there. You can simply get a genetic test now through Color for $199 and $50 off using code BRCAstrong for $150. You don't have to go through your insurance, and you get a call from a genetic counselor right over the phone. Like, I didn't have that option. I don't know about you, Cara. Like, I went and watched a video in a like 4x4 room, and I'm not joking you. And that's how I learned about genetic testing in 2004. I literally sat in a 4x4 room, watched a video on a VHS because, DVDs and stuff weren't
Going
available then,
to school.
right? I'm kind of aging myself, I think, now. Um, but like the scariest thing in the world, I watched a video and I said, yeah, let me do the test. I didn't know what the test entailed. I didn't know skin cancer. I didn't know pancreatic cancer. I didn't know lung cancer for boys, testicular cancers. They talked about breast and ovaries. So make
Mhm.
sure you're talking to the right people when you talk about genetic testing. And that's why Cara has, started her, it's a nonprofit now, right? Is it a nonprofit? Has started her nonprofit. Braca Strong has started, over 6 years, and we're continuing to develop and grow. But making sure that knowledge is power and knowing your options is imperative.
It's so imperative because even just putting the word out about genetic testing would really help women not have to get breast cancer. Because if you know that you have the gene, you're able to do something about it early versus later, where you could live longer.
Early
Maybe have,
detection.
yeah, absolutely. And even I've noticed too, doing my organization, talking with other breasties, it's so amazing to me because whatever your situation is, whatever diagnosis you have, whatever body type you have, whatever type of reconstruction you want to have, when you go and you consult with your doctors, every doctor seems to have their own way of doing things, and they don't always convey all the information as another doctor would. And I strongly encourage my breasties to consult with as many doctors, consult with as many mastectomy doctors, consult with as many plastic surgeon options. They are going to be a permanent fixture in your life for a while, and you want to make sure that you both are on board and create a good treatment plan for you. And if you don't like what a doctor's telling you and you know that you maybe want to maybe have like a flap surgery, then find the right doctor to do that.
And just what you said, right? When we talk about physicians alone and we talk about a mastectomy, your breast surgeon, your plastic surgeon, right? We get overwhelmed. We find out we're either gene carriers or we're diagnosed with breast cancer, right? We go to the internet, we look for options. You're going to find everything on the internet, ladies. Make sure your sources are valuable resources that have updated statistics and update information. Yes, I am going to brag on Braca Strong for our breast cancer women survivors, Previvors. We have every reconstruction option out there. Know those reconstruction options, from anesthetic flap closure to flaps to implants to anything that you need that is available. Making sure you know those options is imperative. And why I say it's so imperative is your body, you can have implants for a really long time and then your body rejects your implants. You might not want to put a foreign body in. You might want to only do a flap. Before you go to your doctor, go online, look at your breast reconstruction options. Know those options. Sometimes educating your physician might work in your favor. Be your own advocate. If
That's
you
right.
go to say you go to Dr. Tracy and Dr. Tracy says, I only do implants, that's your only option, but you want a flap, keep searching for that doctor. You will find that doctor. I tell you, for 1 year, in July, I have fought my insurance for a flap procedure. I am not giving up. I am walking around with one breast and I don't care. You know why at this point? I'm going to do what's best for me, to be my own advocate, to fight where I need to go, and to make sure that I'm okay with Tracy at the end of the day. And I never thought about it like that until I just came to terms with saying, I'm tired of settling. What am I settling for? I've had 10 procedures. I'm going on 11. I want it over. I took preventative action. This is what I chose to do. I chose to educate. I chose to empower. I chose to support and advocate. I won't let myself down, and I'm not going to let any lady out there. And that's really why Cara and I came together. Cara, maybe you want to tell them how we started talking. You want to share?
You go first.
So, obviously, as you ladies know, I connect with women all over the world. You can send me a DM, you can send me a message, you can call me anytime. My cell phone's directly on our site. I'm here to share, and I want to make sure that no provider, no survivor, or no thriver ever feels alone. I think that it is so imperative, again, to have support from our community to be together. And sometimes we find different women that you connect with in a different way. And I felt from when I talked to Cara right before she started her surgical journey, I saw the inspiration that was coming from her and the positive light she was going to shine in our community. So therefore, we just started talking, checking in on each other, reposting each other's stuff. And, that's imperative. It's reposting and sharing because there's more than enough out there for everybody. We're grassroots, she's grassroots. And that means it's just us. It's us
Yeah.
sharing light and shedding light to everybody.
And sharing our stories and being able to like pass the torch on to the next breastie. It's I think there isn't enough talk about mental health when it comes to our type of journey. Though we didn't have breast cancer, we still have our own journey to go through. And while you can hype yourself up and be like, yeah, I can do this and I'm going to have this surgery, but no one talks about like the dark times, the spiral that you can get at in your brain of how destroyed you feel after, how you don't feel like a whole person anymore, just how your body goes through so many changes. And from our community, we talk to these women and being able to shed some light. Look at me, I went through the journey, you went through the journey. Know that there's light at the end of the tunnel, that you can get through it, and being able to inspire others in their journey, I think helps make their journey a little easier because, we are the people that they could look at to say, you know what, if they could do it, so can I. And you just take it day by day until over time you start to get better. I think women feel that they need to feel supported in this journey. I think outside of our community, it may be difficult to be able to be there for someone who has gone through our journey, not knowing what our journey's like, but to be able to speak to other women who get it, and to be supportive that way, and to have the acceptance for one another, and to have that empathy, to have that validation, to know that their feelings are valid. Like, I feel that too. I feel you. You see some posts, you're like, oh girl, that I feel that today. It's
Hmm.
very real, and it's very important to be able to share that in our community as a whole, that no one should ever feel alone in their journey, and that we're all here together to support each other, to inspire and to love one another, and to learn to accept your new you.
The new normal, as they
The
say,
new
right?
normal. Yes.
That's one thing that we're doing at Broca Strong is supporting women to feel the new normal, right? As we're going in for mastectomies, we always post, what do we need? Where do we get it? Where can we go? For 2021, Broca Strong is funding women pre-mastectomy care packages, ladies. If you're going in for a prophylactic bilateral mastectomy or starting treatment, Broca Strong is here to support you. And we're doing pre-mastectomy care packages, which include a robe with a drain belt, a post-mastectomy bra, and 2 post-mastectomy pillows, as well as we offer bras for brave beauties, which we are changing the name because we're going to be offering some other cool stuff.
Ooh.
Um, yeah, we're super excited as new partnerships are still coming in for 2021. We're so excited to always grow. But Bras for Brave Beauties is lymphedema sleeves, bras, and prosthesis. So if you or your family member are in need of any of these items, please make sure you reach out to myself or Kate or Tammy on our board. We're always here to help you. We want to help you feel whole again, feel strong, feel powerful, feel inspired. Like we say, there's good days, there's bad days, But at the end of the day, we have each other to come to, and it's a sisterhood that nobody really wants to be a part of. But once we come together, we're like family and friends.
That's
And
right.
that's really, that's the important part is, like, I know if Cara posts something and I see it, I'm like, hey, are you okay? Like, keeping that open communication, texting women, who are going in for surgery. Yes, we have a private group that's 3,000 women. We also have our Instagram page. Join those safe places where you ladies feel comfortable. Always feel comfortable. Share, ask questions. We're always here to help at Brock is Strong. I know Cara does an amazing job with her organization helping women and just making sure they don't feel alone. Because I remember when I started 6 years ago, I felt alone. I felt different. I felt excluded. I didn't want to share. Then I said, you know what? I'm here to share my story. This is me. This is who I am. Accept me. I've worked hard. I went to college. I had 2 kids. I got divorced. I got into an amazing relationship. Like, there is strength. There is power. You guys can do it, and don't feel discouraged. I know accepting the new normal is not always easy, but getting through it and looking at the different sides of how we can proceed and how we can get better. And what I'd like to say is maybe this can help inspire somebody out there today on the call is my daughter once told me when I came home after an emergency surgery for my expanders, Mommy, you're like a butterfly. You go through different phases of life. And that's how Brock is Strong was created. And that's how I want to empower and inspire others. Ladies, we're like butterflies. Every stage is different. And at the end, we're beautiful again. And whether we want to give ourselves that self-love and accept it or go into an isolation, just remember that you're amazing.
And you are amazing. And it's being able to find and having the resources available to other women saying, I really want to be a part of something. I want to feel a part of a community. I want to feel like I could talk about and share my story with other people. Even in my community, I live in Rochester, New York, and there were no supports available for previvors like myself. And being grateful to have this organization in my community on a local level to be able to provide this support and advocacy for women. But I also do meetups and I'm doing yoga outside. And obviously with COVID, it was a little difficult challenge, and you're doing Zooms and those sorts of things. But now that things are opening again, it's nice to be able to get everybody together again, to give them that sense of space and community to be together again. It's just so important. It just feels very good to be able to give back to other women, because I know what it's like to be alone. And that was like my mission, like going through my story and my mission and my journey was very isolating to me. And I really needed that one person to like help me through. And now that I am in the community, to be able to do that and pass the torch to the next person, it has just been wonderful for me. And I'm so happy and grateful.
It's just it's an unbelievable feeling when you know how many women you're helping, or even if it's just one woman a day, right? When you think about
Yes.
it, you help 30 women. When you think about 40% of African American women, right, have a higher mortality rate and the same risk for a genetic mutation, right? Just
Mm-hmm.
I think that one person that you talk to, or the 1 in 400 of Ashkenazi Jewish women who carry the gene, like, those stats make me want to push harder. I found out 30% of Florida didn't have mammograms. I got a grant for mammograms. Like, we, these are things that we see the problems in our community, why numbers aren't changing, why stats are getting higher, why are women getting caught at later phases, right? Why? We're putting off breast cancer screenings. We're not doing self breast exams. Those are all problems that are happening in our community. And it's like, we can be that voice. We can keep pushing. We can keep sending reminders, but
That's
you
right.
have to be your own advocate. And remember, early detection is the key.
It really is. And being able also to know that you can change your life if you want to do that. And I feel like also like even women who find out that they're high risk for breast cancer, or even like when we get new followers, there's a lot of people in the distance that like to watch you or hear what you have to say. and they might be sitting or have this weight on them for so long that they're not ready to share their story or talk about it with another person, and they're not ready to grieve what they might have to go through. But it's like that one post or that one thing you say, and you could have had a follower that's like follow you for like 2 years, and they finally DM you and they're like, I've been watching you, you know, whatever it is that you were discussing or things that you posted, and for them to finally say, I'm ready to talk about it. It's just so wonderful to be able to help other people. It's so great, you know?
It, and honestly, it's an amazing feeling. You know, before COVID and we were having events, right? One of my board members' sisters never went for a mammogram, just never went. She came to our medical panel. She went for her mammogram and she had breast cancer and she's a genetic mutation carrier. So those are the feelings that are amazing, helping women, guiding women. You know, no matter how much we want to educate, sometimes it's so hard because they don't want our advice. So they need to take their own advice. I'm like over here, sorry.
Sorry, you're coughing.
So, you know, like,
I don't know about, but being a Previvor, you have the Previvor guilt.
Do I have guilt, you said?
Yeah.
The only guilt, and I don't know if it's guilt, the only thing that I wish I would have known more about was having a full hysterectomy at 32 years old and not going on hormones and knowing that I was going to develop severe osteoporosis. And I haven't started treatment yet just because of the long-term side effects, and, you know, going on a bone medication sometimes obviously can have other things. So I have guilt that I did that because my bones hurt, and I'm not going to lie, like my hips kill me, and because it's severe, that's my only regret. Like, there's days that I wake up and I'm like, oh my God, my bones hurt. Otherwise, I don't regret having my mastectomy. I don't feel guilty about it. I feel like I did what was best. And I think I have like a little bit of a not such a regret because of my daughter. Like, I think she's given me that peace to soothe me to know that I'm going to be around to see her grow and I'm not going to have to worry about breast or ovarian cancer. Like, because to me, ovarian cancer is caught so late, right? Like most stages, it's caught stage 3 or 4. Like we lose 22,000 women a year of ovarian cancer. There's no early detection. But the only thing I have regrets about is not knowing the true side effects of the cardio side and the bone side of a hysterectomy.
Mm-hmm. And for me, I because
oh, I lost you.
When I'm around cancer patients.
You're breaking up.
Can you hear me better?
Yeah, go ahead.
Okay. The Previvor I have is being around other breast patients, having the guilt, cheap breast cancer, and not having radiation for dying from.
So I can say that I've seen so many of my family members and have lost friends to breast cancer. And one time I traveled with a survivor. Her name is Carolina, my cross, my scar. We went to New York. We traveled for an event. And I am not joking you. She looked at me. We were getting up in the morning. You know, I'd seen my family on chemo, but didn't really ever travel with a breast cancer survivor. Like, we went to conferences I've seen, but like physically wake up in the morning in the same room and spend days with them, right? She's like, you know, don't mind me. I'm like, oh, girl, don't worry about it. We can handle this. Like, this is easy for us, you know? And when we got downstairs, by the time she was dressed, she was a little tired. And we were talking about breast cancer. And she looks at me and she goes, you know what? I think you're braver than I am, because if I had the BRCA gene, I probably wouldn't do this. She goes, you cut off healthy body parts. You are braver than a survivor. And from that day forward, I don't know if it's about bravery, but I feel like those words that she said to me were just
forever
forever sit in the back of my mind. I work with a lot of metastatic women also now, and I think seeing them go through that fight and supporting them has given me a different vision for it. So I don't feel guilty because it was my choice, right? Like I ultimately decided to do it, but I also saw so many family members struggle with cancer their whole lives.
I have a
I have
similar.
a similar.
So one of
So one of the
my
my
plastic surgery,
plastic surgeons,
she had had
he had
breast,
had breast,
and so
and so when I
every week for
for
my
my fill,
fill, and
and she would see
destroyed
void and
so much pain,
pain,
and she brought me
and
back
she
in.
brought me back in there.
I looked at
I
her.
looked at her and
Can I tell you
can I
something?
tell you something?
And she
And
said,
she said, sure.
"Can I,
And I,
tell me?"
me.
I
I
feel
said, I feel
about
about
what I did.
I did.
And why do
And
you
why do you feel?
And I said,
And I
because
said, because
I needed
I needed breast cancer.
I didn't
I didn't go through
their
their
radiation. I
I didn't lose my.
I had a choice.
I had a choice.
And
she
said,
said, you're brave
because
I didn't have
choose
to
to
breath.
breast.
And
And
you
you
did
did
not
you
do
braver than me.
better than me.
Because
You're going in and out. You're echoing super bad.
I hear it too.
I hear it too. Let's see. Is that better? Let's try again.
So I sound
better now? You're going in and out.
I hear it too.
I hear it too. You want to go back in and come back out? You want to go out and come back in?
Yeah.
Yeah. Okay. Bear with us. Cara will be right back. But as she's gone, ladies, I saw a couple questions from Carrie. I am not on any replacement as of yet, and I'm more than happy to speak to you about it. If you want to send me a DM. And then we talk about extra weight, ladies, from going on. And basically, gaining weight is definitely a side effect that I've seen of a hysterectomy. My hips have definitely stretched. I'm not going to lie. Our bodies definitely change after that as well. Cara, can you hear? Let's see.
Can you hear me now?
Can you hear me now? Better. Perfect. Go ahead. So you were saying the lady in the treatment said to you.
Yes. So
I was
guilty
about
it.
And
And
she said that
you're
bigger than me
because
had I didn't
and you
did it
braver than
me. And that's the
bravery and moving forward. And is it brave? Is it courage? Is it
all of it.
is it for our children? Like when I knew I wanted children, for example, again, in 2004, we didn't talk about your kids were at 50% for this gene. You can do IVF. Like none of this was even thought of. In 2009, when my daughter was born, I still wasn't ever offered IVF, like about embryos and I'm not sure what I really, to be honest, would have done anyway. But like the way our world is changing with our mutations, right? With our treatments, with everything. Like, what do you think in your journey you would have changed?
Nothing. I wouldn't have changed anything. And you talk about genes and variants. I talk to my oncologist, my mastectomy surgeon, a lot because he refers me patients as well. But he said when it comes to genetics, he said there's hundreds of genes that are linked to cancer, and it's trying to narrow down those variants into categories to really, is it really necessary to do prophylactic surgery if you don't have to? So it's going to take years to come up with the science to narrow things down with future genes and links with cancer and what they mean
Right.
for breast cancer.
So, Steph said, dealing with all of this now and feeling guilty that they may need to do all of this. So, Steph, I want to take it back a little bit when you talk about like our children, right? Couple things. I didn't know. So Before I had children, I didn't know my kids were going to be at 50% risk, right? Now we talk about we can avoid giving our children these mutations, right? You can go through an IVF process, whether it's covered by insurance or not, or whether there's funding programs out there. But these are all of these things that you would do. I foresee in the next 10 years, something's going to change for BRCA. Because if we can avoid passing these embryos down into the sperms and all of the IVF terms, right, it's going to be deleted. Then what happens? It's just going to be our future generations. Maybe they're going to come up with a injection. Maybe they're going to come up with a nasal spray. You know, I foresee something being a breaking barrier in our community, especially how over the past 10 years, Previvors have come out, right? Um, you want to answer Carrie's question? It says, have you ladies thought about at what point you will have your kids tested? You
Oh,
want to go
so
through?
for me, my genetic counselor told me that they cannot get genetic testing until they turn, and they
So
have a 50 chance. So, and you know, just kind of have to wait and see. And I haven't told my kids that they could potentially have my gene, because why would you freak them out at this age? I have a 13-year-old and almost 10-year-old, and you know, that's something to discuss as they get older. I mean, they know what I've done, but then they know that I'm very brave and I'm Wonder Woman to them, and they are very happy.
so
And
they don't know you have a mutation.
they know I have a gene mutation, but I don't think their little brains really register yet, like what that means.
Don't be surprised, Kara. I'm telling you right now, my daughter, like she's 12, mind you, I've been very open, like that I carry the gene mutation. I don't hide it. She's a big part of my organization and my reason why for my organization. And she looked at me this morning again and was like, you know, I'm at 50%. When do I need to get mammograms? And I'm like, you're 12. Like,
Right.
where did this come from? But everybody's different on sharing with their children. But I think, you know, when you test your children is a very personal choice. I can tell you that I found out at 21 after undergoing 2 lumpectomies at 18 and at 19. I personally would enforce to any mom or any dad on this call, teach self breast exams, teach them right, know your body, know your changes. If you feel a lump or if you feel a change, call your doctor. I will not even think about testing our children until after they're 21. It put a huge impact on my life.
Yeah.
I know what a lot of younger providers and breasties now are doing preventative surgeries super young. I personally am not for 21. I think that we still need to live life. And as long as we're taking our preventative measures and doing screenings and following up with your physicians, I think that's great. I think that at 21, when I found out, it changed my life. Yeah, I had my career, but I rushed. I got married, didn't know what it was to really be married, understand happiness, coming from a divorced home. Like, where does your mind go at 21 when you're diagnosed with a genetic mutation, knowing it's going to change your life?
Sure.
You know,
You're
making
overwhelmed
sure.
and you want to rush and get it all done because you want to get rid of it.
Right. And that's exactly what I did. And now I just make sure that I share with my children, you know, my son too. I think it's super important that he knows men get breast cancer too. Yes, you need to check your breast. You need to feel your breast. You need to know your body, know your changes. And when it comes to talking about children and genetic testing, I'm probably not the candidate that you want to speak to because, again, I found out at 21, knowing my youngest aunt died at 40 of breast cancer, knowing ovarian cancer, knowing I had a risk of 87% for breast cancer and 67 for ovarian. I rushed life. You know, you already had your children, Cara, right? Like I wanted to nurse. I
Yeah,
knew I
exactly.
wanted to nurse. So I knew that when I had children, when I was done, that was it. Like when my son was 2, he was like 2.5. I'm like, over, we're done. Hysterectomy booked. My OBGYN's like, are you sure? And I'm like, done. 2 healthy kids. I don't know what's going to be in the future. I'm BRCA positive. I need to move on. And
Yeah.
that's what I did. And not everybody can make that choice. It might be the wrong choice for somebody else, but making the correct choice in what you feel and your family or friends are supportive of. Some people talk about it like Cara and I say, and all of these other women. A mastectomy is not a free boob job. Until you have a mastectomy, you don't get it. It's not free implants. It's not a comfortable feeling.
No.
For me, for example, I wasn't able to have a nipple sparing mastectomy 6 years ago. They were just starting them. Like things have changed and everybody's journey is different. Some physicians don't even give you the option to keep your nipples.
Well, it's so
Again,
interesting because like even like I was like, oh, I don't want my nipples. I want to get rid of them. I don't want to have any cells left in my nipples. And my doctor actually convinced me to keep them. He said,
yep,
you know, because you're doing a mastectomy and because I core out your nipples so much, the chances of you getting any reoccurrence of any cancer cells is less than 5%. Just go ahead and keep them, but you just have to keep in mind that you can run into necrosis and you could lose them anyways. So if you're willing to, you know, make those choices and odds, then go ahead and keep them. And so I kept them. I feel like too, like with genetic testing, when you find out that you're high risk, there's a lot of breasties sometimes that will come to me and they're like, oh my God, I got to get this done like as soon as possible. And you have to like remind them, you don't have cancer. You have time. Do your research. If you plan on having babies, have your babies, do your screenings. If you want to breastfeed, you know, just get all the things that you want to do out of the way and enjoy your life before you take that jump. Because once you take that jump, you can't go
it's a
back.
leap. It's not a jump, Cara. Be honest. It's a leap.
It's a very big leap, yes. Yes. But you know, it's just it's important. Just like you have time to process it, it could take years until you're ready. You know, I speak to some breasties who have been sitting on a BRCA diagnosis for years, don't know
I
if they're
sat on
ever going to
mine.
be. And that's okay. This journey is very individual, and the choices they make are individual. And you have to respect it because not everyone's going to do what you're going to do. You have to go what feels good for you.
And that's really the most imperative takeaway from today is do what's best for you, ladies. Find that breast surgeon, find that plastic surgeon, know your breast reconstruction options, know your supports that are out there. Find the correct fit for you. There's so many organizations. Everybody has something different. Find somebody that you can connect with. Find somebody that can benefit, that you feed off their positive energy and inspiration. Because if you get yourself in a dark hole and you don't know where to go, we get lost, right? Let's be honest, you go in a downward spiral and it's over. I've been there. I've done that. Lean on people like Rocka Strong. Lean on people like Cara. Lean on people out there that want to make this experience as best as they can, as easy as they can for you. And here at Brock is Strong, we're here to help you feel whole again and to eliminate the feeling of isolation and get your kits before your surgery, after surgery. If you need a prosthesis or if you need a bra, feel free to reach out to Brock is Strong because we want you to know that you are not alone. Forever thinking of all of amazing Previvors, survivors, and thrivers. And there's lots of genetic mutations out there, ladies. There's lots of information out there. Make sure, again, you're finding the right resources. Use those resources. As I say to everybody, you can have my cell phone number. You can DM me at any time. That's what support is about, being together and coming together as a community. It might not be easy to have a conversation with somebody about, oh, I had a hysterectomy and now I'm facing vaginal dryness, or now I'm facing issues mentally, processing everything. These are all issues that need to be spoken about. Mental health, physical health, spiritual. Stay tuned because we will have a lot of upcoming calls in June on all of this information. And Cara, I really want to say thanks so much for sharing your story, sharing the supports that you offer, and really coming on Braca Strong and making women feel welcome, because that's really what we need to do in our community. Is I remember the first time we spoke, so just when we spoke the other day, leaning on the correct people is so imperative.
It is. Thank you so much for having me, Tracy. I really appreciate your support.
Anytime, anything we can do for you, you know I'm always here, just a call away for anybody who needs it. And stay tuned for more information with more lives coming up. Cara, it was great having you on, great having a conversation. Maybe one day we can meet in person. We are having our first in-person event in September. I will be launching details.
Then
Maybe
you
you want to come to Florida. Maybe you want to come to Florida for a visit.
I would love that. I have a girlfriend who lives in Vero Beach. Are you close?
Like an hour. It's not
Okay.
bad.
Hey, you never know. Might make
You
it
need a
work.
vacation, right? You need a
Gotta get out.
vacation.
New York today. I'm in New York. It is 40 degrees and I'm wearing a sweater.
Oh, well, it's 80 degrees here, and I'm probably going to go sit outside and do some work by the pool.
Be nice. You enjoy that sun. I'll be here
Vitamin
in my
D.
winter jacket.
We need vitamin D.
Yes.
Well, I hope you have a fantastic weekend, and we look forward to having you back on.
Sounds good. Thank you, Tracy.
Take care, ladies. Have a great day.
Bye.
Bye.